Hi, my name is Guillen Austria. I'm an MPH student at UC Berkeley in the Epidemiology and Biostatistics program. This summer, I worked on a secondary data analysis using data from the Mexican immigration to California, agricultural safety and acculturation, or MICASA study, with Dr. Susana Matias, a faculty member in UC Berkeley's Nutritional Sciences and Toxicology department. The MICASA is a prospective cohort study involving 467 hired farm worker households in Mendota, California. The spirometry portion of the study was added to assess lung function. We conducted this analysis to evaluate the association between dietary patterns and chronic diseases among immigrant farm workers in California, a historically understudied and hard to reach population. So first, I reviewed and familiarized myself with all the study materials. Since data was collected from 2006 to 2010, there were a lot of materials to review, and I wanted to understand the study as much as I could before beginning to work on the analysis. This included datasets to look through, data dictionaries, and previous papers written using study data. I also reviewed materials on how to write a literature review and manuscript and found papers that were relevant to the topic. And first, I began with creating a statistical analysis plan that outlined what I learned about the study and how I plan to conduct the secondary analysis, including what variables I'd be using, deciding my exposures and outcomes, and type of analysis I'd be doing. And while working on the SAP, I also began looking for literature to use in my paper. After completing the SAP, I was able to begin my analysis. This included the following dietary exposures: fruit and vegetable intake, fiber intake, percent dietary fat, and sugar-sweetened beverage consumption. The health outcomes we used were high blood pressure, waist circumference, and obesity. What we found from the overall sample was that the average age was around 38 and most participants were female. Most participants were born in Mexico, completed primary school or less, and made less than $20,000 annually. The average age of immigration was around 24 years old, and most did not attend school in the United States. On average, participants consumed 5 servings of fruits and vegetables per day, 20 grams of fiber per day, and about 35% of their caloric intake was from fat. As for the outcomes, almost half of the participants had high blood pressure, over half had a high risk waist circumference, and over half were classified as having obesity. Overall, in the multivariate analysis, we found a negative association between higher fruit, vegetable, and fiber intake and high risk waist circumference in this population. Working on this analysis this summer, I learned the importance of paying close attention to detail when it comes to coding, troubleshooting when I have errors, and of course, time management when independently working. I'm grateful for this opportunity on this project, and I hope I can apply these skills throughout the school year and in my career. Thank you for listening.